Hi everybody, it's Lisa Driley. I'm here to discuss our week 3 module. The skills that I have within the position that I have right now, I manage the clinic, the urology clinic. So I work with staff. As far as staff goes, I work alongside them, I manage them, I communicate, I direct them. Directing was another skill that was in the book. Directing by communication, setting that expectation through communication. I do a weekly um, I do a weekly email. What's new? If I do it on Wednesday, it's a what's new Wednesday, which is usually when I try to do that. We have huddles. We have staff meetings every month, so communicating is probably my major form of management. So communicating the expectations, communicating what's new, what to expect, um, what's going well, what's not going well. So communication is key, remaining calm and cool. We've had sometimes when we've had providers who do not remain calm and cool. So for me to be able to set that example and be calm and cool and try to work through the situation after they can calm down is very helpful. I'm very approachable. Staff often come and approach me about time off, things that aren't going well in the clinic, things that are going well in the clinic, things that happened throughout their day that I may not have seen, that they felt was important for me to know. So that's another skill. Organizing was a skill mentioned in the book that I do a lot of. So I organize the staff schedules, provider schedules. Um, I also have two telehealth nurses that I try to keep them organized, as well as to what they're doing from a day-to-day aspect. And being a positive leader, I think, is very important when you work in a position that I do, because I work alongside staff. So I'm a coworker, but I'm also a manager. And so being positive and setting that example, I think, is really very important in the job that I do as a manager. The literature that I read was literature around interdisciplinary communication via smartphone. So I thought this was very interesting because I think we're not going to get away from smartphones. They're only going to become more and more a part of our lives, and it looks like they're going to creep into our work life. So some of the things that were talked about in the article was telemedicine. Um, Telemedicine is a app. There are some apps that you can have on your smartphone that patients can do self-testing. Patients with high blood pressure, diabetes, that do self-monitoring at home. There are apps for them to be able to share that information with their provider directly through the apps. So that would be a benefit for the provider and for the patients, a good way of communicating back and forth. It would allow nurse practitioners, nurses, to be able to dictate notes and be able to manage their time by having timers on for how long they take to do certain tasks, like perhaps patient phone calls. If you find that you're spending a lot of time that way, you can help manage your time by setting timers. Video calling, that would be very beneficial in a home health setting. Should you have a nurse that was at someone's home and saw something and needed a provider to be able to look at it, you could video call, and that would allow not the hands-on approach exactly, but I guess an eyes-on approach, which is sometimes very beneficial if you can't have the hands-on approach. And of course, the nurse would be there to be able to facilitate an assessment. Um, Having quick access to medical journals and textbooks via the smartphone. No more going to the library and picking up the book. Everybody Googles, so that would be a benefit. Being able to place orders or look at labs that were drawn, maybe labs that were drawn by a home health agency that would be then taken to a lab, and the doctor getting those results and being able to make adjustments to medications perhaps, or different things that would need to be addressed after some lab work has been drawn. Monitoring heart function, so wearing a monitor that would monitor heart function, heart rhythms, different things like that. There are apps out there that can go on smartphones to help providers manage things like that. E-learning, surgical simulations are also done by video. So there are a lot of options out there for using smartphone technology, and we're using it right now, making our videos. So it's definitely going to be some piece of our future. For question 3, identify the levels and departments that you would need to work with in order to be effective in your role. So in my role, I work with many departments. I work with other clinics, so communicate with other clinics about staffing. If you can help another clinic out that needs help with staff, so you're communicating with just other clinics within the ambulatory setting. I work with other urology clinics. Some are in Raleigh, some are in the cancer center, so communicating with them. Communicating with the supply people to make sure we have the supplies that we need. Talking with vendors that come to the clinic, so professionals that come in wanting us to use their supplies, buying their equipment, different things like that. Working with the providers, of course, and the nurses within the clinic is another, I consider that another department. Even though it's where I work, I still have to work within that system. I guess EVS would be another one. Infection prevention. We do high-level disinfection in our clinic, so working with the infection prevention people is a very big topic. It's something that I work on quite frequently. So I work with a lot of different departments on different levels as well. The structure and model of our clinic, I don't know that would really change, or that I would prefer for it to change. We do have a horizontal type setting, so we have leadership across the top, which would include the ambulatory financial manager, the ambulatory vice president, and the medical director, and the clinical operations director. All the administrative directors are on that top line. Above them would be the vice president of the ambulatory clinics, and above that would be the president of the hospital, because we are hospital based. And then under that would be my leadership setting, and then below that would be the nurses and the CMAs. So we have that type of a setting in our clinic, and I think it works well, and I don't know that changing it would be a benefit. I think it functions very well. We make strides and get things done, and we work well as a team. So that is my post for week 3. Thanks.